Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Today, we are going to talk about gynecomastia. Gynecomastia is a problem that is quite commonly seen on gentlemen, where we have a little bit of excess tissue on the glands in the breast area, and on certain cases, even excess of the skin. Therefore, there are going to be different procedures, whether we just have to remove a little bit of fat, whether we have to remove fat and glandular tissue, or whether we have to remove fat, glandular tissue, and skin. All of those are the options. Let's go talk about them in the operating room. The surgery for gynecomastia is going to depend on what exactly the anatomical findings are. Many times, all we need to do is liposuction. We will make a small incision, and through that, we're going to be able to harvest the excess fat and flatten things out. If that's not enough, because there's also too much glandular tissue, then we will have to make an incision somewhere, typically around the edge of the areola, and through that, we can remove the excess glandular tissue. It does leave a scar if we do that, but it's a small scar on most patients. Sometimes even that is not enough, because patients, especially patients who may have lost a lot of weight, might also have a lot of sagging, hanging excess skin. This is always a tough call, because we do not want a big scar if we can avoid it. And many times what we will do is try to be patient, remove the fat, remove the glandular tissue, and give the body time to recover to see if that excess fullness flattens out by itself. Sometimes it's obvious that that is not going to happen if there really is way too much skin. And in those cases, we will do a formal reduction by making an incision somewhere to remove the excess skin. Sometimes we will do just the first two steps, give it a little bit of time, and only if need be, come back for the third step. Our goal is to give you the most natural appearing result where you don't have something that obviously tells everybody that you had surgery. The procedure can take anywhere between 45 minutes to 90 minutes for most patients. At the end of the surgery, we'll wake you up and you will have some sort of bandage around your chest or a compression vest to help apply a little bit of pressure and minimize the swelling and help with the bruising. And after that, you get to go home on the same day. Let's go talk about the recovery. Recovery after gynecomastia surgery is going to depend on how extensive the surgery was. If it was just liposuction, it's honestly a breeze. There's going to be a little dot or two or three that are going to heal quickly, a little bit of bruising, a little bit of swelling. It's going to take 10 days for the bruising to go away, and probably 3 to 4 weeks for most of the swelling to go away, and 6 to 8 weeks for all of the swelling to go away. But you're going to feel fine from day one. The occasional ache, but you're going to be fine. You might take pain pills for 2 or 3 days and then stop taking them altogether. If we also have to remove some glandular tissue, you will have an incision with some sutures, and the sutures usually come out after a week. And there's going to be additional bruising and swelling, which makes the recovery a little bit slower. If we have to make a big incision to remove excess skin, of course, there will be more sutures, a little bit more bruising, a little bit more swelling. But even in those cases, the recovery is pretty prompt. Patients typically are going to take just a few days or maybe a week off work and go back to the gym after about 2 to 3 weeks and feel like everything is completely healed after 2 months. And if you have a long scar, though, the scar maturation is a process that takes up to a year, where it continues to fade and get better and better. But you'll be feeling back to normal after just maybe 2 months tops. This is going to be a complete recovery, and I expect you to do very well after gynecomastia surgery. Thank you for choosing Ideal Plastic Surgery. We are the biggest plastic surgery center in California, and we have reached this unique position by taking care of you, our patients, with our entire team approach. Everyone here is a certified professional with lots of experience. Our team of surgeons, our team of anesthesia providers, nurses, techs, all we do is plastic surgery, and we do it with full passion in order to give the best possible results, learn every day, improve every day, and give you, our patients, the safest and best results, and continue to grow together. I am confident that you're going to achieve the results that you want for your surgery with Ideal Plastic Surgery, and look forward to seeing you here soon. Thanks.